And now I'm going to introduce our next speaker, who's Manjit, who's Deputy Chief Nurse and Director of Midwifery at Croydon. And Manjit, the screen is yours.
Thank you very much. And it's brilliant that I'm able to join you all. So firstly, I would like to say how very proud I am being a midwife and a nurse working in the NHS. And I think it was almost like Sheena's handed the baton to me. The amount of generous donations from the community, from our local community to the hospitals, that actually made a massive difference in the first lockdown. Staff really did feel appreciated, and they were working very, very long hours. Some of our staff didn't go home. They actually moved in to, they booked a room at the hotel accommodation facilities that were available in the first lockdown. So firstly, a big thank you to all the staff that work in the NHS, and in particular to our midwives, our healthcare support workers, and all key workers, because they really did keep everything going. So I wanted to start off with that. So my worry in the first lockdown was I was promoted as Deputy Chief Nurse, and I was very excited in my new role, thinking actually I'll be learning the ropes of how a hospital works over the general side. And within 2 weeks, we had gone down into full lockdown. And our chief nurse, who is very, very supportive, took on the role as the senior responsible officer for COVID-19. So I was left with as business as usual for the rest of the hospital. So it was a massive learning curve. But what was remarkable was how all the teams pulled together. And it didn't matter whether you were brand new or you were in the system for many, many years, all the staff did pull together. There was a point where staff were asked to be redeployed, where community services were shut down, closed down. So thinking about our health visiting colleagues. So basically they had less than 3 days notice. They were informed that they weren't doing community clinics because of the lockdown, and they needed to come in to support the general side. So just thinking about that, just holding that thought of how scary that must have been for staff being redeployed to an area that they're not familiar with. But boy, did they really step up to the challenge. And we had over 30 staff coming in from the community and helping on the general wards. The other success story, which was remarkable, was we had BA staff, so British Airways staff, because they were furloughed or waiting to be made redundant. They offered their services and worked in NHS hospitals. And we had over, I think it was probably over 35 cabin crew who came and helped, firstly as volunteers and then became paid workers. And we've now actually employed some of those BA staff. We've got 5 BA crew who no longer work for BA, but actually are maternity support workers. So I think that's another success story. And they really have made a difference. So again, I thank not only the key workers, but actually people working in the travel industry. They really did step up to the mark. The most difficult experience, I'll try to hold it together, for me was actually the visiting. And I know that's very, very topical, especially for maternity, where because of the lockdown, patients in hospital were unable to have visitors to begin with. And I looked after, she was actually a member of staff. Her husband was actually dying. And the question was asked whether she could go in and say her last goodbye. So that was a real tough period of time. And of course, the consultant in intensive care actually said, why not? So that member of staff wife did go into say goodbye in full PPE. And I'm so proud that, that decision making, was facilitated for that patient and his wife. And really reflecting on that, during the first lockdown, I know the previous speaker talked about, Sheena actually, about funerals. So recently I've attended one of my friend's funerals, and it was very therapeutic. It was just coming into the third lockdown and able to attend a funeral to say goodbye to your loved ones and supporting friends and family. You know, it almost felt like full circle within the COVID time. So moving forward on what I'm really excited about is our hospital was one of the 50 hubs for the vaccination. And I'm very pleased to tell you that the vaccine was rolled out in our hospital well over 4 weeks ago. And I think Sue had mentioned earlier on, you know, there is categories on who should be having the vaccine first. So over 80, our patients were over 80, they were invited in. But because of the way the vaccine is made up, we need to make sure that no vaccine is wasted. So all staff who are in the high risk category could put themselves forward for the vaccination, and that is how the programme is rolled out. Having said that, there is also an opportunity for any member of staff who would like the vaccination towards the end of the day where vaccinations are still available, so we're not wasting any vaccinations. And I'm very pleased to tell you and share with you that I have actually had my COVID-19 vaccination, not only my first one, but I've actually completed the second dose a couple of days ago. And I was really, really pleased that that was on offer at the Trust. And I'm feeling fit and healthy and really looking forward for the end of this lockdown and new hopes of, you know, the majority of people being vaccinated and that we really get past COVID-19. I'm going to stop there. Happy to take questions.
That's fantastic, Manjit. Thank you so much. And it's so lovely to hear that you've gone the whole story and actually illustrating having the vaccination and how it's being done on the ground, which is fantastic. Because I think sometimes when you're listening to the radio, you might think nothing's going on anywhere, and are the staff okay? And that's lovely. It's just so lovely to hear. So thank you for that so much, Manjit.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.